A health alert this midday. Children's hospitals in North Texas and around the country are becoming overwhelmed with those RSV cases. Unfortunately, this year, the virus has come a little earlier and hit harder than in previous years. The RSV virus primarily affects young children, but can also cause serious disease in the elderly. Our medical expert, Dr. David Winter from Baylor Scott White Health, joins us to explain what's really going on. Good morning, Dr. Winter. Tell us about this virus. What is it and how can it be identified?
Yeah, RSV is respiratory syncytial virus. Those initials also, to me, can mean really serious viral infection. That's what we see in a lot of young children, particularly under age 6 months. The symptoms are head congestion, runny nose, cough, sore throat, and if those progress to worsening breathing, high fever, and a really, really bad cough, that's when you need to seek medical attention. Now, the kids get it because their immune systems aren't quite up to speed yet, and they also have very small, narrow airways, and so secretions can clog up. That's why they get it, and the older adults tend to do a little bit better with it.
Okay, you mentioned older adults, the elderly, also being susceptible to this. Should adults be concerned about the virus?
We can get it, Tashara, but most folks that are healthy, otherwise healthy, it's like a common cold, lasts less than a week, 2 weeks at the most, mild symptoms. No, it's the elderly, the frail elderly, and folks on chemotherapy or any drug that lowers your immune system. Those are the ones who need to worry about getting outdoors when the respiratory syncytial virus is out there, like right now. Consider wearing a mask. Consider those vaccines. The RS vaccine could help them.
Okay. How about treatments besides the vaccine? What else might help for those who are sick with RSV?
Well, there is a medication out there now. It's called Beyfortus, but before you consider Beyfortus, I think you ought to make sure you have the right diagnosis. All these symptoms, RSV, COVID, influenza, even some case pneumonia, they overlap. And so be sure you have the right diagnosis. The right diagnosis leads to the right treatment.
Okay, and before I let you go, Dr. Winter, I do want to ask a question. How's COVID numbers doing right now?
Yeah, they're still up there. Fortunately, they're pretty mild right now also. I'll tell you, the last 4 mutations have all been pretty mild. The next one may be mild, it may not be. I worry about that, so I'm encouraging folks to get a COVID vaccine if you hadn't had one recently.
Okay, especially as folks start to gather with families for the holidays and all of that. Dr. David Winter, always a blessing to hear you speak. Thank you so much. Appreciate it.
Thank you, Tashara. Take care. Bye-bye.
Bye.